Hello, my name is Alejandro Lasso, and my topic is functional recovery in a 67 years old man with Staphylococcus aureus spinal cord abscess. Definition: spinal pleural abscess is a rare invasive infection, Staphylococcus aureus, being the isolate causate again in most cases. The clinical trait of back pain, fever, and neurologic signs is not always present.
Undiagnosed epidural abscess leads to permanent paralysis. Hi, my name is Bill Raffier. I'm a Florida personal injury lawyer, also practicing the area of medical malpractice. Today's video is about an undiagnosed epidural abscess. First, let me explain what an epidural abscess is. Our spinal cord is surrounded by a covering called the dura. Sometimes this dura can get infected from another side of the body, a cut on the foot, a cut on the arm, but it travels through the bloodstream and seeds on the dura. And what happens is, as this infection grows and grows, the patient has more and more severe pain. The severe pain leads to weakness and ultimately, if not diagnosed timely, to complete paralysis. Often, when a patient comes to a doctor with unexplained back pain, that is back pain not explained by some physical activity or an automobile accident, the doctor will sometimes feel the patient is a drug-seeking patient, seeking pain medication, or is making up the symptoms for some other type of gain. Ultimately, though, if the patient is persistent and does show some weakness or weakening of the muscles or muscle tone, they'll be placed in the hospital. If the appropriate tests are done timely, such as an MRI exam of the spine, the abscess can be located, can be evacuated or taken out, and the patient has a full and complete recovery. Unfortunately, I've handled a number of cases in which a misdiagnosis occurs or a major delay in diagnosis, which leads to paralysis. For example, I represented a lady who was a bookkeeper in a large Orlando law firm who went to her doctor with unexplained mid-back pain. She was appropriately admitted to the hospital and tests were performed, but not the appropriate imaging tests on her spine. While my client was in the hospital, the doctor actually ordered the appropriate MRI study of the spine to be performed right away. Unfortunately, the nursing staff did not follow the doctor's order. When asked why that order was not followed, they explained that the patient was claustrophobic and would not do well within the MRI tube. I spoke to my client and she said she's never been claustrophobic in her life. That was a made-up excuse for the nurses not doing their job. Unfortunately, she was paralyzed from the chest down. Epidural abscess is a very serious injury, serious condition. Thank you for watching this video.
Application in physical therapy. Therapy in epidural abscess is based on pain control through cold compress and through different physical methods that help control neurological signs in the stage that they are present.
Hi, I am Dr. Vidyadhara S, Head of the Department and Consultant Spine Surgeon at Manipal Hospitals, Bangalore. We nowadays come across lots of patients with spinal infections, especially tuberculosis, which we were supposed to get eradicated from this world, is actually come back with a vengeance. Maybe partially it is because we have bad food habits and lack of immunity, because of which we are more prone to infections. And secondly, also the bacteria is becoming more and more virulent and very aggressive, and nowadays we encounter more of MDR tuberculosis, that is multi-drug resistant tuberculosis, and also in immunocompromised patients such as AIDS, these incidents of spinal infections is much more. The other area where we get spinal infection is patients getting operated in smaller setups with not very hygienic setups. There is a higher incidence of infection which we will have to relook as to how bad or how much damage it has caused and then treat it accordingly. Most of the spinal infections can be treated medically with the use of either IV or oral antibiotics. However, if it comes to the point of risking your neurological structures in and around the spinal cord, we may have to intervene with the surgery to decompress and stabilize the bone. But having said that, even with surgery, the ultimate treatment is medical and a long-term antibiotic is a must in cases of spinal infection. And normally if it is a pyogenic or pus-forming microorganism, we give antibiotics intravenous for 6 weeks and oral for 6 weeks. And if it is tuberculosis of the spine, the treatment can range from 9 months to 1.5 to 2 years. And here again the emphasis is on proper diagnosis, for which a biopsy is a must. A lot of patients get treated empirically as tuberculosis, and ultimately when the drugs don't work, we have very less choice of treatment, and that is why we always do a biopsy so that you have a proof that whether it is tuberculosis or pyogenic. And secondly, with the present day norm of gene expert tests, you get a fair idea as to whether the drugs that we normally use for treating tuberculosis are effective in the case that has been biopsied. And it is almost always curable. The spinal infection doesn't lead to any morbidity or mortality if treated adequately and appropriately.
Pros and cons. And the pros, the reduction of surgical time, and there is a possibility of discompress the concomitant success. And in the cons, faced with too aggressive preparation, there is a risk of ventral injury to the blood vessels. Issue applied in Ecuador. The prognosis of the spinal epidural access will depend on functionality, the general and neurologic state of the patient when the disease is diagnosed, the time of the evolution of the clinical picture, and the speed in the establishment of an adequate treatment. The authors review rate that the time of evolution of the neurological deficit is directly related to early clinical symptoms. In the conclusion, an epidural access is a collecting of pulse and hertz between the outer covering of the brain, the spinal cord, the bones of the skull or the spinal column. Physical therapy helps, but it is only an aid, while the main thing is surgery and medication. Thank you.